Let's talk about cervical cancer screening because this is one of the screenings that's often missed and it is changing in today's day and age. For years, it just meant getting a pap smear every few years, but now we're doing different types of tests both in Canada and the US. We're moving from pap smears, which we'll talk about, to more HPV testing, which directly looks for the high risk types of human papillomavirus that cause almost all cervical cancers. Now, like we talked about in our previous video about colon cancer screening, the reason screening is so important is because you're trying to catch these cancers when they're very early on and when they're more treatable. Cervical cancer is unique because it's one of the most preventable cancers that we have, and we'll talk more about that. So when it comes to cervical cancer, that HPV, that human papillomavirus, is very important to understand. Almost all cervical cancer is going to come from long-term infection with certain types of HPV. And the virus spreads through sexual or intimate skin-to-skin contact. And if you've ever been sexually active, you've very likely been exposed to it, or the possibility that you have the virus is certainly there. Most of the infections, most of the types of HPV, they're going to clear on their own within a year or two, and they're never going to cause any harm. So even if you do get a positive HPV result, that doesn't automatically mean that you have cervical cancer. So don't be alarmed. The danger, again, is those high-risk types that stick around for a long time, and then that persistent infection can slowly turn those normal cervical cells into abnormal cells, and then a part of those are what become cancer. And this process can usually take a decade or more, and the slow timeline is exactly why cervical cancer screening works so well, because it takes time for it to develop. There's a long window that we have where we can spot the risk and treat precancerous changes before they ever become cancer, or treat the cancer when it's early. And screening's actually been fantastic for cervical cancer. It's already driven the rates down dramatically, and most of these cancers are happening now in people that never got screened regularly. Now, whether you get the HPV test or a pap smear, the process of getting the test done is going to look pretty similar. It's essentially the same swab. So with the HPV swab, when that's sent to the lab, what you're looking for here is if that high-risk version of the virus is present. And if it's negative for that high-risk HPV, your chance of developing significant precancer cells over the next several years is going to be quite low. And that's exactly why, if you have a negative HPV test, it generally buys people a 5-year interval before they need to get it repeated. Whereas a pap smear, instead of looking at whether or not that virus is there, it's going to look for specifically your cervical cells under a microscope. And the question there is, are there any abnormal cells that have already shown up? Now, the PAP is a very good test, and on its own, it's prevented enormous numbers of cancers over the decades, but it is less sensitive than HPV testing, and that's why it often has to be repeated every 3 years rather than every 5 years. And whichever test you're getting done, like I said, the process is essentially the same. They're going to go through the vaginal canal and get a swab of the cervix, which is just that outer part into the uterus. So now, if the PAP's been doing a great job for a long time, why are we moving towards HPV testing? Basically, there were 4 randomized trials done, totaling more than 250,000 people, that basically found that primary high-risk HPV testing caught more cases of a certain type of precancer that was very likely to become cancer rather than cytology or PAP testing alone. So HPV testing is better at finding people at risk earlier. Now, just because it's more sensitive doesn't mean you should just be doing it all the time. Like any other test, there's risks to getting a swab done. They're not very high risk, but there are risks of infections, bleeding, and then results which cause unnecessary repeat testing, unnecessary biopsies, anxiety for the patient. So the point of a more sensitive test is that we should be able to do it less often and still have it function. Now, when it comes to the specific details of screening, it's different province to province as far as Canada goes, but most provinces are again going towards the HPV screening. So you can simply Google your own province and see what the current cervical screening guidelines are, and talk to either your family doctor if you have one, or go to a walk-in clinic and they should be able to set it up for you. And I'll show you here. So basically, under the age of 25, routine screening is not recommended because, again, HPV is so common. People are becoming sexually active generally at this age. And so starting early will mostly find infections that would have cleared anyways. So you might be leading to investigations and biopsies that weren't really necessary. But obviously, if you're having symptoms, then again, like we talked about before, that's not screening. That requires workup. So if you're having bleeding, discharge, pain after sex, anything new like that that's not going away, that's not related to a period, that requires further workup regardless of your age. This is for people who do not have symptoms and we're just screening. Now, from 25 to 69, The new recommendation is doing the HPV test every 5 years after a negative result. If your province is still using the pap test, then usually that started at age 21 or when someone became sexually active, and that was typically every 3 years. And then 65 and up, again, it's going to depend on your specific province. But at this point, it's really a discussion of the patient's goals, their risk factors, how previous testing went, and it's really up to the patient if they'd like to continue. Now, in the US, unfortunately, things get a little bit complicated because different scientific bodies have different recommendations. So we'll walk through them. But again, the best thing to do is see what the guidelines are locally for you, discuss with your physician what your risk factors are, and decide for yourself when you'd like to start screening, which tests you'd like to do, and how often you'd like to do it. So when it comes to the American Cancer Society, they generally start later, and they're entirely focused on HPV testing. So from 25 to 65, it's clinician-collected primary HPV testing every 5 years. And then the alternative would be to do your own swab for HPV testing, but that would be every 3 years. You can do co-testing every 5 years, which means getting a pap and an HPV test, or pap alone every 3 years when you don't have HPV testing available. And again, they don't recommend 21 to 24 either. They start at 25, they go till 65. And then again, the older you get beyond that range, it again depends on your previous test, what your goals are, what your risk factors are, and it's worth discussing with your physician. And then you have the American College of OBs and the Women's Preventative Services Initiative. They recommend from 21, so earlier, 21 to 29, a pap test done every 3 years. From 30 to 65, again, that HPV testing every 5 years, or the alternatives. And then 65 and above, again, varies patient to patient. So a lot of the guidelines, even though the small details might be a little different, generally speaking, as you can see, the trend is HPV testing and somewhere in that range of your 20s into your 60s. So just to tie that in a bow, if you're in Canada, look at what your province locally does. Generally, it's going to be some combination of what you see here, where you start at 25, the primary test is the HPV testing rather than a pap. And then in the States, you might have a pap every 3 years, 21 to 29, then switching to HPV. And above all else, depending on your own risk factors and previous screening, have a discussion with your physician along with what your goals are to see what's most appropriate for you. Now, like we were talking about earlier, cervical cancer is unique in that we actually have a vaccine that can prevent cancer, and it's really the only cancer where we have such a thing. So the idea of screening is to find the problem early on, whereas obviously with vaccination, the idea is that we're stopping the virus from causing problems in the first place. Now, the vaccine is called Gardasil 9, and it's protecting against 9 strains or types of HPV viruses, including 16 and 18, which cause roughly 70% of cervical cancers. Now, it works best before any exposure to HPV, which is why both in Canada and the US, it's aimed at preteens before most people become sexually active. It's not going to treat any infection that you already have if you already have the virus, but it will still protect you against virus types that you may not yet have. So it might still be worth it in adulthood or after this age range, after you've already become sexually active. So in Canada, the National Advisory Committee on Immunization recommends routine vaccination starting from age 9 to 12, delivered through school programs in most provinces. People from age 9 to 20 need 1 dose, 21 to 26 need 2. And then in the other category, you have people who might be immunocompromised or living with HIV or something that makes them high risk, they'll need 3. And basically, this vaccine is authorized up to age 45, so it might still be beneficial for people even well into adulthood. In the US, the CDC recommends routine vaccination at 11 or 12, or you can start as early as 9, and then a catch-up for everyone through 26 who wasn't vaccinated earlier. If you start the vaccine series before 15, then it's 2 doses. If it's after or the person's immunocompromised, then it's 3 doses. And then for people from 27 to 45, it's essentially a discussion between you and your physician, and it really depends on what you decide. This is just based on averages. They're considering that at that age, most people will already be sexually active and likely to already be exposed to the viruses. But again, everybody's different, and that's worth discussing with your own physician. I know these days vaccines are the talk of the town, and everyone has their own opinion on it, which at the end of the day, you're an adult, you can make your own decisions, but this is just what the latest guidelines and the data suggest. So you'll notice based on these recommendations, the biggest benefit is getting it early to prevent ever having the exposure of those viruses. But again, it's not a cure-all. It doesn't mean that you don't have to screen if you got vaccinated. They still sneak through. There's different virus subtypes. So one does not negate the need for the other. Now, like we said, with PAPs and with HPV testing, the cervical swab that you have to do Most of these are going to be done by the clinician in their office, but some people aren't comfortable with the pelvic exam or they just don't want to get it done for any other reason. You do have the option to collect your own sample as well. So for this, you'll have to talk to your own physician or a walk-in clinic to see what's available in your province or state, and they'll give you an approved swab that you can do yourself along with instructions. So this is an option for you. So don't feel like just because, you have any hesitation of a pelvic exam or it's painful for you or you have cultural reasons, whatever your case may be, it doesn't mean you can't be screened. You still have options. Just a couple things to keep in mind though, if you are going to do it yourself, there are risks involved with that, including just getting an inadequate sample, because obviously clinicians will have more experience getting these swabs than individuals do. So that might result in things like false negatives or false positives. And if you do get a positive result, then the next step is going to be back with the clinician anyways. So just keep that in mind. So let's say you got screened and you get a positive HPV result back telling you that yes, you have human papillomavirus there. So take a deep breath. Like we talked about, this does not automatically mean that you have cancer. All it means is one of the high-risk types of HPV were found. And what comes next is going to depend on what's present. So there are other types, but like we talked about, generally this is HPV type 16 or 18. And what we do next is going to depend also on your PAP results, if you got that done, your past results. Is this new? Is this old and stable? Have you had a colposcopy before? Have you had any treatment before? Your age, are you immunized? So a lot of factors there. If you do have the high risk types, especially 16 or 18, more than likely you're going to be sent straight to a colposcopy. Now the idea with the colposcopy, the OBGYN in their clinic is going to look through with more light and with more magnification at the cervix, and then they may take another sample at this point or just take a look at what they're seeing. If you have another or lower risk type, then you might have a repeat test or maybe a PAP done to see what's going on. And then depending on all of that together, the next step might be a biopsy where they go in and they take a small sample to get some definitive pathology results. And that's going to be the most accurate test that you get. And then those biopsy results are going to be what truly tell you that is there cancer present or is there precancerous lesion present. And then obviously depending on the test, your obstetrician gynecologist will guide you on what the available treatment options are and what they need to do from here. Whether it's removing that cancer if it's just small enough, if it's precancerous, does it need a partial hysterectomy or partial removal of the uterus and the cervix entirely? Does it need a total hysterectomy? Further imaging? All of these things are really guided by the specialist at that point, depending on what those biopsy results show. But the point is just understanding that just because your test came back positive, it does not automatically mean that you have cancer. So please don't be alarmed. Let the workup do its thing. Again, though, generally speaking, at a primary care level, if you do get a positive result back, you'll generally be sent to an OBGYN to get a colposcopy or further workup, and they'll guide things beyond that point. Now, so far, everything that we discussed was for average risk people without any symptoms. There are people who need a different screening schedule. So if you have anything like HIV, previous transplant, if you're on immunotherapy medication, if you have a prior history of abnormal pathology, if you've had cervical cancer, if you've had treatment for a high-risk lesion before, all of these things, your screening schedule is going to be different, and it's something you need to discuss with your doctor. And like we've talked about before, symptoms are not screening. So again, if you're having any symptoms, bleeding, pain, discharge, that's not going away, that's not being explained by anything else, that's something worth investigating, regardless of your age or when your last exam was. So the bottom line is, with cervical cancer, vaccinate early if you can, if that's something you believe in and would like to pursue. That's what the guidelines and the data recommend. We're looking for high-risk HPV with our screening. Some places might still use PAPs, but again, that's usually on the way out. And then ultimately, if you get an abnormal test back, the next step is going to be sending you to an obstetrician gynecologist for next steps, which depending on the results of your biopsy, of your tissue sample, may or may not include a partial hysterectomy, a total hysterectomy, or just local resection. So that's pretty much everything for cervical cancer. I hope that was helpful for you. Be sure to check out the newsletter and the community in the description. We actually have a free screening checklist there with both Canadian and US guidelines to make sure that you're all caught up regardless if you're male, female, whatever age. So be sure to check that out. It's all free. Let us know what you want to hear about next, and we'll see you next time. Cheers.